Hi, this is episode number 9 in the Perio Patient Podcast, PPP, and I'm Ben Young. Last time I left you with the idea of cementum. That was the last word, cementum, and it comes out of my explanation of what is periodontal disease, and that a tooth has just 4 parts, and the 4 parts are enamel, dentin, pulp, which everybody knows, or pretty much everybody knows. And it's the 4th part of a tooth that's important when we're talking about periodontal disease. And it's given the name cementum, and it cements or holds something to the root of this tooth that directs out in all directions these little fibers that attach the tooth to the bone. I make a big deal of this because without this understanding, we get in our minds a wrong image of what's going on. And this is important because it explains how disease can occur here. The teeth aren't fused to bone. There is a space, and in that space are fibers which are soft tissue organic. Now, very small, not much space here, but microscopically they're different than the root of the tooth and the bone. There's a space or a gap that's filled in, but it's a space. Anyway, we were talking last time about why getting into this was important. And it is the idea that you can only go so far in general descriptions. And once in a while, you just have to come down to a new definition, a new term. And that's what that's all about. I don't want to go into tooth has 4 parts right now. We could do that later. We can always do anything later, couldn't we? Because this is a conversation and we're just talking. And I'm trying to share with you what I think can help you and motivate you towards taking care of yourself. And so I want to just say a couple of things at this point that I think are good reminders. Actually, 3 things, I guess. One is your home care. It needs to be daily. It needs to be gentle. It's the frequency, not the intensity. You need to be thorough in doing it. In other words, there needs to be a routine about it. A lot of people talk about the intensity of toothbrushing in terms of the amount of time. I don't really care that much about that. I know it's sort of a mindless activity, all of it can be, and I don't have a problem with timers, but I want it to be intentional, and I want you to move around and do as good a job as you can, working as much on being light in your strokes and going around the mouth so that you're specific as best you can. You have to understand, though, that your best will only reach so far into pockets. It only goes about 3 millimeters maximum, and you can't force it to do any more than that. If a person were to try to floss beyond 2 or 3 millimeters, they're just cutting the gums. So it creates injury. Now the body has to heal from not only the inflammatory response from the bacteria, but also the injury, which is also an inflammatory response. The body has to heal now from 2 things, not just one. And so to me, it's more in terms of home care. It's what you do every day. It's kind of like, and maybe I'm hoping, and maybe it's a foolish hope, but I'm hoping that when you get little podcasts like this, it's a reminder at least to set up a behavior, a habit, that maybe if you listened, had some sort of set interval, and if maybe I can put these out frequently enough, at least at first, that you kind of get in the habit of listening, that would then remind you to floss your teeth at a certain time. It's more that you do it on a daily basis than that you're the best at it. I think that one of the things I've learned, even in learning dentistry, is that it's the repetition of activities that develop skills. I think at first a lot of us in dental school wanted to go faster. And the thought was, well, if you could go faster, you could treat more people. But it's kind of a naive way to look at it. When you look at it from a musical standpoint, people who play musical instruments can tell you that oftentimes you have to slow it down in order to really develop the hand motor skills necessary to do a really good job. And that if you're having trouble with a passage when you're playing, you slow it down, maybe slow it down half and work it through until you're so comfortable there you can now increase your speed. And then the brain just takes a while to get the patterns down. It's the same with brushing and flossing. I just want people to be careful with it and not overdo it. And we go into that. I go into that in the book. So the other thing I wanted to also say, I said that there were three things from your standpoint that could be useful, and I've said one, that's the plaque control. The second one is basically the second responsibility I talk about in the 2004 parts. That's the appointment management. That's going back when you need to go back. That's taking care of yourself by being proactive. I know what it's like to neglect and avoid. I know what it is personally to do that, not to get a physical examination when I needed to do it and delay it a little bit. I know that. It's part of human nature. What I'm saying, though, is that it's really important that you make every effort to stay on track with it yourself. And then the final thing is, I work with a lot of outstanding dental offices, and not every dental office is the same. And I've kind of divided them in my mind into two groups. The first group is what I would call general dentistry. These are general dentists who can do things, treatment. But there's another group that comes out of the general dentistry population that I'm going to call comprehensive dentists. The difference simply is, and it could even be attitudinal, it's just that people are seasoned over a bit of time to step back and understand that they are taking care of patients, and they've moved away from the idea that they're doing a procedure. People who are looking at patients as the carriers of teeth to do a filling or whatever, that's not the level at which those dentists really feel comfortable working with specialists, frankly. So I don't really interact that much with them, not by my choice, but theirs. But fortunately, there are a tremendous amount of very competent, comprehensive dentists who care about all aspects of a patient's care, above and beyond whatever they themselves can do for somebody. And these are the ones that interact well with someone like myself. And they're caring about your blood pressure and other aspects of your life that are the things I care about. So we have in common this philosophy of patient care that treats patients as people, and we step back normally from just a single problem that we can identify on an x-ray to ask the questions of, well, what's the big picture here? Why is this person losing teeth? Why are these fillings deteriorating, or have they? How long could they last? What else could we do here to improve a person's life? Maybe it has to do with sleep apnea. Sleep apnea is a real important area, and dentistry is going more into this than ever before. And if you have any questions on that, that's not an area I personally work in, but I know people who are very good at it. So these are all things that I think you can take control of and be in charge of. So that's it for now. Have a great day.